Hi, I'm Tom Bagwell, and welcome to Hello Health, a partnership with the Ochsner Health System and Humana. Today's topic, tremors. What causes them, who's at risk of developing them, and ways to treat them. Our guest is neurologist Amy Jones. First, some background. Dr. Jones was born and raised in Gulfport, Mississippi. Me too, so already she's a favorite. She received her medical degree from the University of Mississippi in Jackson. She completed an internal medicine internship and urology residency at the prestigious Mayo Clinic in Rochester, Minnesota. Before leaving the Mayo Clinic, she completed a fellowship there in clinical neurophysiology with an emphasis on epilepsy. She's board certified by the American Board of Psychiatry and Neurology, and it is our pleasure to welcome for the first time Dr. Amy Jones to Hello Health. Good to have you with us on the program.
Thank you, Tom. It's
Thanks
great
for
to be
being here. So first we should point out you're not a psychiatrist, right? But it's the same board that approves both.
Yes, it is.
Okay, good. And the story of how you got interested in medicine, and in particular the area of neurology, is an interesting one.
Yes, so my grandfather was a general practitioner in a small town in Mississippi. And when I was younger, he had a large stroke. And I can remember him trying to explain to me at a young age that something went wrong with his brain, and that was the reason why he couldn't move part of his body. And that was the first time that I can remember being fascinated by the brain and its connection with the body and how it controls everything. And then when he passed away some time later, we had droves of people come to his funeral and come to tell us how much he meant to them as their physician. And that really inspired me to go into medicine. I wanted to help people like he did.
Have you found it to be, I know you're not at the end of your career, but have you found it to be everything you had hoped it would be?
Oh, that and more. It's hard work, but it's the most rewarding job, and I love it and love my patients and all the people I work with.
I'm sure your grandfather would be is very proud of you.
Thank you.
Tonight we're talking about tremor. So what is it?
So a tremor is a repetitive, involuntary movement of a body part. Most commonly that's in the hands or the arms, but it can also involve the head, it can involve the chin, it can involve the voice or the trunk or even the legs. And it can be a disorder in and of itself, or it can be a symptom of something else.
And there are different types of tremor, right?
Yes.
Okay.
So the main types of tremor we categorize into kind of three broad categories. A resting tremor, meaning that the tremor comes on when the arm is completely relaxed or at rest or not moving. An action tremor, or a postural tremor, which comes on when the muscles are activated or moving or in a certain posture. And then an intention tremor, which comes on when the arm is going to reach a target, and it gets worse as the arm gets closer to a target.
Let's break each of these down a little bit. What can cause a resting tremor?
So a resting tremor, the most common cause can be Parkinson's disease, but it can also be caused by a buildup of copper in the body. That's a disease called Wilson's disease, or it can be an abnormality at the base of the brain or the brain stem.
What are some other signs that might point to Parkinson's other than a resting tremor?
So other signs that might point to Parkinson's would be a shuffling gait, or that you don't pick your feet up as well as you used to and the foot slides across the floor, a stooped posture when walking, freezing of the gait or trouble initiating a movement. So patients with Parkinson's disease might try to stand up and they want to take a step, but they have a hard time taking that first step, and then once they get going they find it easier. Rigidity or stiffness of the muscles, loss of arm swing when the patient's walking. So when we're walking a long distance, we're swinging our arms and we just don't even think about it. It's something that's automatic, but that can be a very early sign in Parkinson's, is that the arms don't swing when we walk. And then the tremor, the resting tremor that can happen with Parkinson's, can worsen when the patient walks. Imbalance or falls, loss of facial expression, and then a change in the voice or a softening or a lowering of the voice.
Does Parkinson's disease happen at different stages for different people? Are these the kinds of changes that you might not even notice, or in most cases, are these going to happen overnight?
Right, so it does come on gradually. It tends to happen in older people, but we have some people that show signs at a younger age. And so if any of these are noticed by the patient, even if it's gradually, it's best to get checked out early.
So we talked about a resting tremor. What is an action tremor?
So an action tremor comes on with movement, like we talked about earlier. So you might notice an action tremor if you're doing something as writing, drinking, eating, trying to button the buttons on your outfit, and it stops when the arm is at rest or resting in your lap. It can be most commonly in the hands or the arms, but we see action tremors in the chin and the head and the voice as well.
What can trigger and cause action tremor?
There's a lot of different causes for action tremor. So one of those is a physiologic tremor. So all of us have a little bit of a baseline tremor. It might get worse with caffeine or nicotine or anxiety, such as if we're on a TV show. Fatigue of the muscles.
I don't detect anything now, but that's good.
Fatigue of the muscles can cause a physiologic tremor to worsen. Certain medications, such as breathing treatments to treat asthma, steroids or even antidepressants can worsen a physiologic tremor. An overactive thyroid can worsen a physiologic tremor or fever. The most common cause, though, for an action tremor is what's called essential tremor. It's tended to be called benign essential tremor, but we don't like to use that term benign because it indicates that it's not a big deal, but it can be a really big deal to people. This can be a very disabling tremor because of how it affects how patients do their day-to-day activities. So essential tremor tends to run in families. It's genetic. We actually don't know exactly what causes this, but it's felt that there's something going on in the brain stem caused from a genetic disorder that leads to this tremor coming on. It can start in young age and slowly get worse throughout the patient's life, but commonly we don't see people present with essential tremor until they're older and it gets to the point where it's affecting their day-to-day life. It can affect one side more than the other, but people tend to notice it on their dominant side. If they're right-handed, they notice it more in their right hand because that's what they're doing things with. It's most noticeable again when people are eating, drinking, writing. It can also not only affect the hands, but it can affect the voice and the head. So people will have a kind of nodding head tremor or their voice will shake when they talk. It can worsen with stress or caffeine, and then it's also better with resting and can be better with alcohol, some people will notice.
What's the difference between a tremor and a muscle spasm? And is someone who gets muscle spasms likely to develop tremor at some point?
Good question. So they're two separate things. Muscle spasm is where the muscle tenses up and contracts. And that can be from a problem within the muscle itself or the electrolytes in your body or dehydration, or can be from indicating some damage to the brain that's leading to a muscle spasm. A tremor is a totally different disorder and entity, and it's more of just this repetitive movement and not a constant contraction of the muscle.
But for someone, obviously someone who's having tremor should have them checked out. What about someone who's having muscle spasm for 30 seconds or so and it goes away? Is that a warning sign? Is that a reason to go visit the doctor or no?
If it's bothersome to you, certainly you should go and visit your doctor and talk to them. Typically people will start off talking to their primary care doctor about a muscle spasm or a cramp in the muscle, and the primary care doctor might want to run some basic tests, make sure you're not dehydrated, things like that. and refer you to a neurologist if they feel like it's necessary.
All right, we talked about a resting tremor, an action tremor, and the final one is an intention tremor. Talk to us about that.
So intention tremor is not as common as the other types of tremor. An intention tremor worsens as you get closer to a target. So the tremor might not be as noticeable until you get close to that glass you're trying to pick up, and then the tremor really comes out. And we see this type of tremor with problems in the brainstem or the coordination centers of the brain. So this could be caused from a stroke. This also can be caused from buildup of copper in the body or Wilson's disease. So this is certainly something, if you notice it, that you need to get checked out right away.
Our guest tonight is neurologist Amy Jones, and tonight we're talking about tremor. This is the part of the program I'd usually turn to the guests and ask, how do we diagnose what we're talking about tonight, in this case tremor? But with the wonderful work of our creative services team here at Ochsner, we're going to show you how that would work. Here's the diagnosis with Dr. Jones.
So here we are in our clinic in Covington, Louisiana today. And I have my nurse Kirsten here that's going to help demonstrate what an exam would typically consist of to evaluate for tremor. So the types of things that we often do to examine is have patients hold the arms out, because holding them out in a certain posture activates the muscle, and when the muscle is activated, that can trigger a certain type of tremors. Then we'll have the patients put the arms where they're up like this, almost touching but not quite touching, and that will bring out what's called a postural tremor. Also, to evaluate for Parkinson's disease, we want to see if there's any slowness of movement. So we have the patients tap their fingers as fast as they can, and Kirsten's tapping is nice and normal and fast, and she can keep up. But also just remember, we're on your side, we're here to make a diagnosis, so there's no need to stress or worry. We're here to evaluate, see what the tremor is, get to the bottom of it, and get you on the right treatment.
And we thank you and your assistant for that. So there were nothing to be worried about there, but in some cases you will need to proceed further, right?
Right. So Kirsten, my nurse, did not have a tremor on the example, but the other thing that we do along with the exam findings that were demonstrated in the video is we have people draw a swirl, because watching you write or drawing a swirl can really bring out a tremor, especially an action tremor. If, depending on what we see on the exam, we may want to get lab work looking at the thyroid hormone or the copper levels in the blood, as those can be other causes for tremor. And then in some cases, if we're worried about a stroke as a cause for the tremor or some other cause, we might get an MRI scan of the brain to look into that further. There's another type of scan called a DAT scan that can diagnose Parkinson's disease, so sometimes we get that as well.
So how do we treat tremor today, and has that changed over the years?
It has. We've developed more treatments and newer and better ways to treat the very difficult cases. So the treatment really depends on what we find on exam and what the diagnosis is. So for Parkinson's disease, it's going to be specific medications for that. For essential tremor, it's going to be specific medications for that. And for other things, such as if the thyroid hormone is off or the copper level is elevated in the body, we have specific treatments for that.
And let's talk about all of those individually. First the general, then Parkinson's, and then the essential tremor.
So for the general tremor, we try to limit anxiety, we try to limit caffeine or any other stress or trigger that we might see. For Parkinson's, Parkinson's disease is a lack of or a low level of the neurotransmitter dopamine in the brain. And so the mainstay of treatment for that is to give you back dopamine. And so there's a medication called Sinemet or carbidopa levodopa. And what that is dopamine. and we give the patients back that, and it can dramatically improve their Parkinson's symptoms. There are other medications and options that help elevate the dopamine level in the blood and the brain in different ways.
Now, are they just treating the symptoms, or are they treating the disease and or curing the disease, or no?
Good question. Unfortunately, we don't have anything at this point to cure Parkinson's or to treat the disease in and of itself. Giving the body back dopamine treats the symptoms and helps keep them at bay. There is research, though, that shows that physical activity and exercise does slow the progression of Parkinson's. So we always encourage our Parkinson's patients to stay active, exercise, and keep physically active. That's going to slow the progression.
What about mental exercise, crossword puzzles, Sudoku, those sorts of things?
Yeah. Well, those are beneficial and for different reasons, and we think that perhaps doing those activities could potentially prevent or lower the rate of Alzheimer's disease or dementia. For Parkinson's disease specifically, it is not going to hurt, but it's more of the physical activity we want our Parkinson's patients to do.
And what about essential tremor treatment?
Mm-hmm. So there's kind of two first-line treatments that we often go to. The first is called propranolol. The brand name is Inderal. And that's actually a heart rate and a blood pressure medicine called a beta blocker. But it works beautifully for tremor if patients can tolerate it. You need an EKG, or a heart rhythm test, first to make sure that your heart rate is not already slow, because propranolol slows the heart rate down even further. And so side effects can include a slow heart rate or lowering of the blood pressure, and that can lead to dizziness or fatigue if the blood pressure or the heart rate gets too low. But patients who tolerate this with the heart rate and the blood pressure, it can really improve the tremor. The other first-line medication is called primidone or misaline. That's actually an old seizure medication that we don't use so much for seizures anymore, but it works very well for tremor. I find that some people don't tolerate this very well, though, and the main side effects of that are fatigue, sleepiness, or dizziness. If one of those first-line medications doesn't work, or there's reason to not use that, then we move on to some other medications, and those are mostly seizure medications that we try to see if they would improve the tremor. Not that tremor is a seizure, but that those medicines also work to calm a tremor down. Botox can actually be used for voice tremor. Instead of getting it injected to help with your wrinkles, they inject it into the voice box, and it can help with the voice tremor. And then for very refractory cases that don't respond to medicine, or people can't tolerate the medicine and the tremor is at a disabling level, there's actually something called deep brain stimulation, where wires are implanted into the deep parts of the brain, and a battery pack that's in the chest stimulates through those wires down to the deep parts of the brain and can improve or control tremor.
So lots of options.
Yes.
Including some involving the patient, himself or herself, right? Some things that aren't even medicine related or procedural related.
Right. So if the tremor is more mild, or if the medicine's working but you just need a little bit of extra help, there's some tools and tricks that can be used. Some patients find that heavier weighted glasses or utensils can really help, because if you weigh the arm down, the hand can't shake as much. Similarly, a wider based pen or pencil can be helpful because the muscles aren't having to squeeze as much to hold on to a larger diameter pen or pencil, and that can help with writing. People find stabilizing with the other hand can be helpful as well. And then there are new technological advances, and there are eating utensils that have stabilizing mechanisms in them to help stabilize the end of the spoon so that the food doesn't fall off of the spoon.
Amazing. What should you tell your doctor about your tremor?
Yeah, so a lot of times people don't pay attention to the details because they don't know what to pay attention to. And so I always tell people to look at, when did your tremor start? How old were you? How has it worsened over time? Did it start suddenly, or did this creep up gradually? Because that can help us determine what might have caused it.
It might even be good to ask someone you're living with.
Right.
You may not even notice it, or may not want to notice it.
Exactly. So sometimes the people that are around you notice it before you do, especially when it's come on so gradually. It's easy to kind of ignore that. Pay attention also to, does it happen at rest or with activity? What things tend to bring it out or make it worse? What things tend to make it better? Is it in one hand and not the other hand? Is it in your head, your voice, your legs? And then ask around and see if there's any family members with tremor. Oftentimes with essential tremor, patients will come and say, no, I don't have a family history of tremor. But then when they go back and they talk, they find out their siblings or their aunt and uncles or parents do have tremor. It's just not as noticeable, and nobody's ever talked about it.
You may have said, when did it come on or what brought it on? Is any of this ever diet triggered, or what would be some of the triggers for this?
Yeah, so certain medications we see as the most common trigger for a tremor. So pay attention to if a medication was started and then the tremor appeared, because it may just be a medication side effect, and it's as simple as switching to a different medicine or lowering the dose, and the tremor can really improve.
In some cases, patients are going to come in with tremor, and you're going to have to give them the bad news that it's a symptom of something much larger. What advice would you have for patients who would be afraid to come in and tell you that they have tremor, knowing that it could possibly mean they have something more substantial than that?
Right. I oftentimes see that. People are very afraid. But what I would say is, don't be afraid. We're on your side. We want what's best for you. And it's best to get diagnosed early and get on the appropriate treatment. We can make great improvements in quality of life with appropriate tremor treatment. And if it is something more serious, we need to know about that, because we could prevent it from getting worse, or at least slow the progression.
Before we end the program, we want to see if we have some questions from our viewers tonight. But what would you think, before we get to those, what do you think it would be that your grandfather's thinking of right now if he were watching this program? And I hope that he is.
Well, I would hope that he would feel proud of the way that myself and all of us in the Ochsner health system care for our patients and have compassion for them, because I know that was very important to him.
Okay. We do have one question from our viewer, and I'll pass it along. I'll paraphrase it here. In what percentage of the cases is it just tremor that can be dealt with that isn't part of something larger, Parkinson's disease or something like that?
Yeah, so the vast majority of tremor that we see is essential tremor. And I didn't say this earlier in the program, but the good thing about essential tremor is it's not a progressive neurodegenerative disease, meaning it's not going to ultimately lead to much faster failing health and be the cause for death
like
or problems like Parkinson's. Essential tremor can be disabling because the tremor happens when you're writing or eating, but we are very good with medications or deep brain stimulation, a lot of times with controlling the tremor, and people can go on to live a very normal life.
Great advice. Thank you very much, Dr. Amy
Great. Thank
Jones.
you for having me.
You're very welcome, and I hope you will be back with us. I want to thank Dr. Jones for the education and information she has provided today, and for her work in the Ochsner Health System. To make an appointment with any of Ochsner's physicians, including today's guest, or to register for any of Ochsner's Hello Health seminars, you can call the number right there on your screen, or you can send us an email hellohealth@ochsner.org. There's our address. As a reminder, you can rewatch today's presentation or many of our Hello Health programs on Ochsner's website at ochsner.org. Just type Hello Health in the search area. I want to thank Ochsner and Humana for making our program possible, and our final thanks, as always, is to you for your support of our program, Hello Health. We'll see you here on your next appointment.